So imagine taking your healthy dog to their annual wellness exam, and instead of waiting for cancer signs to appear months later, a simple blood test finds it first. Sounds like science fiction, but a new study suggests that we're getting a lot closer to this. The problem is that cancer is the leading cause of death in older dogs. The biggest challenge isn't treating the cancer, it's finding it early enough. So most canine cancers are discovered only after owners notice the clinical signs of weight loss, limping, coughing, decreased appetite, or actually seeing or feeling a visible mass. And by then, many of these cancers have already spread. But a newly published study called CLASSIC, the Cancer Lifetime Assessment Screening Study in Canines, is the first prospective study to follow apparently healthy dogs over time using next generation sequencing blood tests that are designed to detect cancer before clinical signs develop. The researchers enrolled over 700 client-owned dogs at 24 different veterinary hospitals across the US and Canada. Most of these dogs were considered at an increased risk because of their age or their breed. So what is a liquid biopsy? Instead of looking for tumors on an X-ray or ultrasound, researchers look for tiny fragments of tumor-specific DNA that's circulating in the bloodstream. Every day cancer cells die and they're going to release microscopic pieces of DNA called cell-free DNA. And using this next-generation sequencing, scientists searched millions of DNA fragments for genetic changes associated with cancer. Kind of think of it like trying to solve a mystery by finding microscopic clues before anyone realizes that a crime has even happened. Of the 417 dogs included in the interim analysis, 51 dogs developed cancer during the study, and the blood test correctly identified cancer in about 60% of those dogs. But here's what really caught my attention reading the paper. Its specificity was nearly 99%. That means that false positives were very uncommon. Only about 1% of dogs without cancer had a positive result. So remember, sensitivity tells us how many cancers we find. Specificity tells us how often we falsely alarm owners. They both really matter. Now, here's the most exciting finding to me. This is the result that made me really stop reading and think a lot. With routine veterinary care alone, only 6 of the 51 cancers were detected before clinical signs developed. When researchers added the liquid biopsy, 28 of the 51 cancers were detected preclinically. That's an increase from 12% to like 55%. So in other words, adding that blood test increased the preclinical cancer detection by almost fivefold, and that is a remarkable finding. Does this mean that this test finds every cancer all of the time? Nope, it does not, but that's incredibly important. The test missed 22 cancers. Skin tumors, especially mast cell tumors, and some localized cancers were much less likely to be detected because they're not releasing enough tumor DNA into the bloodstream. So a negative result does not mean your dog definitely doesn't have cancer. This is a screening tool, not a replacement for physical exams and imaging, biopsies, and other blood work. But what happens if the test is positive? A positive result doesn't automatically mean cancer treatment starts. It means your veterinarian begins the searching process. This is going to include a physical exam and blood work and x-rays and abdominal ultrasound, maybe fine needle aspiration or biopsy of suspicious lesions. The blood test tells you there may be a problem. It doesn't tell you exactly what or where the cancer is. But as a veterinarian, I think this study represents something much bigger than a blood test. It suggests veterinary medicine is beginning to shift from finding cancer after dogs become sick to actively screening high-risk breeds while they still appear healthy. That's the same evolution we're seeing in human medicine with screening programs. My overall take on this is I'm really excited about these results, but cautiously so. This wasn't a perfect test, and it didn't detect every cancer. We still need long-term studies to determine whether finding cancer early actually translates into longer survival and better quality of life. That's the question that ultimately matters to all of us. But if future studies continue to support these findings, the liquid biopsy could become one of the most important advances in preventative veterinary medicine over the next decade. So if your veterinarian offered a blood test that could screen your healthy dog for cancer before the clinical signs appeared, would you choose to have it done? Let me know in the comments.